Let's move to the next oral presentation with an engaging topic about glycemic control of type 2 diabetes mellitus during COVID-19 pandemic in Thai rural area, a mixed method study, presented by Ms. Kanyakorn Siraprapapong.
Greetings, ladies and gentlemen. My name is Kanyakorn Siraprapapong, a fifth-year medical student. Today, this is my honor to present to you our project entitled Glycemic Control of Type 2 DM during COVID-19 Pandemic in Thai Rural Area, a mixed method study. Type 2 diabetes mellitus is one of the largest health burden, requiring long-term regular care by both self-care behaviors and medications from the hospital. Moreover, there is an upward trend of diabetes estimated by the International Diabetes Federation. The study in national terms found that there is about 60% of uncontrolled DM in Thai population in 2018. Unfortunately, since 2019, the entire world has experienced the most devastating public health emergency in our lifetime. In addition, the study in the United States showed a significant association of medical access with uncontrolled type 2 DM. Accordingly, in general, the healthcare volunteer have to play a main role for the medical access by providing rudimentary care and initial diagnosis in areas that are far from the hospital. Nevertheless, they have to take more responsibility to deal with the COVID-19 pandemic instead of the old routine. Also, their training session for the NCD prevention was interrupted, and this all lead to an inadequate diabetic care. So, we aim to study the prevalent and associated factor of the uncontrolled DM during COVID-19 pandemic in Thai rural area. As an explanatory sequential design method study, we conducted a quantitative process at a cross-sectional study using cluster random sampling to select 5 villages from the diagram to represent the entire diabetic population. We view the medical record from 2 hospitals, then collect data using care record form with the support from the well-trained community health volunteer. For the analysis, we use descriptive statistic and logistic regression analysis, and using hemoglobin A1C and fasting blood sugar to define the uncontrolled type 2 diabetes. Then, the qualitative study was conducted using purposive sampling to divide the participants into 2 groups, adequate control and uncontrolled diabetes. And a group interview and in-depth interview were organized by manually open-ended questions. After the recording was transcribed, we analyzed by the thematic analysis. For the result, of the 142 DM patients, 70% of them were female, average aging around 61 years. Most of them were agricultural workers and unemployed. About half had first-degree relative with type 2 DM, and half of them has obesity. 17% use insulin injection to control diabetes. For the evaluation just during COVID-19 pandemic, despite the fact that most participants reported no change in every aspect, I would like to highlight the changes like the rising in stress level and also the declining in income, medical access, dietary intake, and physical activity. Defined by the hemoglobin A1C and fasting blood sugar, there is about 80% of patients with uncontrolled diabetes at the time of the study. For the associated factor of uncontrolled diabetes, decrease in medical access were the only factor that associated with the uncontrolled type 2 DM. For the qualitative result, of the 21 patients included, 14 consented to join the group interview and 7 preferred the in-depth interview. In this group, there is around 80% of uncontrolled DM patients. We could divide the behavioral changes during the pandemic into 6 themes: the medical access, stress level, income, dietary intake, physical activity, and family. In this presentation, we focus on the decrease in medical access during the pandemic, since this is the only factor that had a significant association. Most patients state that their glycemic level had altered because of the pandemic. Their medical access was being affected by the COVID-19 countermeasure, especially the public transport restriction. As participants said that because there is the lockdown policy, many cannot travel across the province, and thus I cannot access the medication, resulting in hypoglycemic crisis hospitalization. And many patients state that the hospital policy light up delivery or one-stop service led to doctor-patient contact time reduction. Only those with extremely high blood sugar level will be examined by the doctor. Like participants are said, I didn't get to meet the doctor in person. The doctor will check only the person with very high blood sugar level. For the discussion, we discovered that 80% of the patients have uncontrolled diabetes. Compared to the national trends in 2018, this is surprisingly high. However, due to the pandemic, we are unable to reach the expected sample size. This may have had an impact on the study relevance. The study showed a significant association of medical access with uncontrolled type 2 diabetes comparable to the study in the United States. Despite the cross-sectional study design, we were unable to evaluate the temporal sequence. However, we got the qualitative data to explain this association. This was affected by the COVID-19 countermeasure, either the state countermeasure or the hospital policy. Even though the majority of the response indicate that there were no behavioral change during the pandemic, we discovered the trend of the changes that have had an impact on the NCD according to the Department of Disease Control of Thailand survey. In conclusion, the massive prevalence of uncontrolled diabetes is a critical problem. Glycemic control is impacted by the decrease in medical access. This demonstrates that the standard of diabetic care can still be improved. Hospitals should consider telemedicine in emerging pandemic to minimize the gap between doctor and patient relationship and also to maintain the regular care for the NCDs, including diabetes, since patients couldn't get in touch with the doctors. Community volunteers will need to support the health promotion. This is crucial to improve the skill of the health volunteers and the patient understanding of the self-care. To tighten the glycemic control. And this is the end of my presentation. Thank you for your attention.
Such a concise explanation.
Any comments from our judges?
Do you have any prevalence of DM type 2 in this your subject before COVID-19 to compare it? The prevalence of the uncontrolled type 2 diabetes in this area. Yes. In the past, in 2018, we found about 64% of the uncontrolled DM in this area. I mean that in your subject that you said that during COVID-19, maybe increasing it is very uncontrolled. But before that, COVID-19, that subject is always uncontrolled or not. To be continually uncontrolled or uncontrolled during COVID-19. From the qualitative result, we found that the DM patients had said that their glycemic level had been altered after the COVID-19 pandemic.
Okay. Do you have more questions?
Yes, please. You said medical access is the problem for non-controllable. How is the community context related to this problem, or is it just the medical access alone? Can you explain this result with the context of the community? For example, the location, the networking, or whatever in the community.
Okay. In this area, in Chakri, the patient has to travel very far to get to the regional hospital like Nam Chai Khet Hospital. So there is a problem in transportation because of the restriction of the public transport. As I mentioned in my qualitative result, and also because of the COVID-19 pandemic, the community health volunteer who is normally help in providing the care for the diabetes is hard to deal with the COVID-19 pandemic, so they are unable to provide the adequate care in the NCD in this area.
Any more questions?
Yes. Can I ask, did you compare the severity of the uncontrolled DM between behavioral lifestyle and ESS medical? Which one that more impact? Did you measure how difference between two group of the two things? Because you said the access of medication is quite worse in this case, right? And how about the behavioral lifestyle, such as stress, income, and others' behavior is related with uncontrolled diabetics or not?
Well, from the multivariate model, I have adjusted all the behavioral change I mentioned before in the study, and the significance show that there is only medical access that is significant associated with the uncontrolled DM.
Thank you so much.
Thank you very much.